Hello and welcome to our session on virtue ethics from the medical debate. Today we'll be talking about a theory of ethics called virtue ethics, and we'll be relating it to medicine and medical aspects. So what are virtue ethics? Virtue ethics focuses on people being the most virtuous versions of themselves, so the best versions of themselves. The key aspects of this are being exactly as kind, generous, truthful, active, and good as possible without it acting in detriment to the person's character. This idea was originally started by Socrates and further explored by philosopher Thomas Aquinas. Thomas Aquinas was heavily influenced by Socrates as well, and was around the same time as Henry of Ghent. So that's just some background for you, and we're going to be talking about some of the same stuff. So we will cover virtue theory, eudaimonia and two vices, GMC guidelines and how they relate to virtue theory, and as well as using virtue theory in the medicinal world. And after you've looked at virtue ethics, where can you go from here? Where can you take this even further and learn a bit more? So we're going to go talk about vices and eudaimonia. So when being virtuous, you must be so virtuous as to fall in between the two vices and therefore attaining eudaimonia. Eudaimonia is basically the ultimate amount of happiness. Eudaimonia is how happy can you get, like the maximum amount of happiness you can have. Eudaimonia and the two vices. In virtue theory, every virtue has a limit, which means all people can only be virtuous if they fulfill the virtue up to the limit and no more. These two vices are deficiency and surplus. So you could be too virtuous or sorry, like having too much of a certain virtue and therefore offsetting the balance, or you could have too little virtue. When you are fulfilling the sweet spot of virtue, this leads to eudaimonia, or full attainment of this virtue and its resulting happiness, which is ultimately what all people strive for. People like this do exist, according to Socrates, and are called virtue exemplars, but only a few exist. So only a few people in the entire world exist that are absolutely perfect. They have the right amount of virtue and they inspire people to be like them. Here's an example of the use of virtue. And the use of the virtue courage is what's at question here. This is a case study of daylight robbery and your action on this. So you can answer on the comment section and you can put your answer there. We'd love for you to see how you can use this theory of virtue, and we'd love to see what your answers are, and we'd love to see how you came to them. So please feel free to put some reasoning behind it as well. An elderly woman is being robbed. You see this happening. According to virtue theory, which option should you carry out? A, should you just ignore the crime? B, should you intervene, as that is what a courageous person would do? C, would you intervene after assessing the situation and realizing that you can in fact help? And if it is not possible for you to intervene successfully, then you do not intervene. So more of a diplomatic answer there. And D, only help out when the robber leaves. So take some time to answer this. I'll give you 1 minute. And if you feel like you want to just see the answer, please skip 1 minute ahead in time. But your 1 minute starts now. Okay, so your 1 minute is up, and the correct answer is C, because you should be thinking about helping people, but then you don't want to run into a situation where you would actually be doing more harm than good. And that is what virtue ethics teaches about. Socrates says that if we can't be perfect, we must strive to be good, and we will become virtuous after practicing goodness. Virtue ethics focuses on your character. So I'm pretty sure that you guys have all heard of the GMC guidelines to being a good doctor. And I highly recommend that if you haven't heard of it, you take a look at it, take a printout and start reading, because it's basically good. It's called Good Medical Practice, and it tells you about how to be a good doctor and what you should do in specific situations. And we're going to try and relate it to virtue theory. So this is an extract from the GMC guidelines, which you can access at that link. And it says, patients need good doctors. Good doctors make the care of their patients their first concern. They are competent, keep their knowledge and skills up to date, establish and maintain good relationships with patients and colleagues, are honest and trustworthy, and act with integrity and within the law. So as you can see, that actually covers most of the pillars of medical ethics as well as relating it to virtue theory. So we're going to try and relate it to virtue theory now. Okay, so you should always try to maintain good relationships with patients. And you should always try to build a relationship with your patient so you can actually get some information in them, build a rapport so they feel more easy around you so they can actually tell you things. But does anyone know or have any ideas as to what a surplus of this may count as? I'm going to give you guys 1 minute to come up with some ideas, and then we're going to go through an idea that I came up with previously. Your 1 minute starts now. Okay, so that is 1 minute up, and we're going to go through an example that I came up with previously. So eudaimonia is right in the middle of a scale, and that is the perfect amount of virtue you should have. Not too much, not too little. Not talking to patients and being too robotic, that would count as being too little virtue. But then not maintaining professionalism, that would count as a surplus. And we're gonna go. I'll give you a few seconds to think about that, but you have to come to the perfect amount of virtue. As you can see, you have to be able to talk to them, otherwise it's a deficiency, but not maintaining professionalism would be too much. Okay, now we're going to be talking about honesty. You should always be honest wherever you go, but does anyone have any ideas as to what a surplus of honesty may be? Okay, so again, I'm going to give you 1 minute before we reconvene, and I'm going to talk us through an idea. Okay, so that's 1 minute up, and we're going to go through an example. So eudaimonia is right in the middle of a scale again, and in this scale, you can have too much honesty, or you could have too little honesty. Too little would be a deficiency, too much would be a surplus. That is the balance of the scale. That's the right in the middle, and that's the perfect amount. Not being honest enough with patients or lying or withholding information, that would be dishonest, and that would be a deficiency of virtue. but breaking doctor-patient confidentiality, that would be a surplus of honesty, and you cannot let that happen either. We're going to be talking about confidentiality like we did in the previous slide, but these are the 7 Caldecott principles, and they tell us about privilege, why you should not break this unless there is no alternative, and what exactly counts as confidentiality. We may do a future session on this, but this is good reading material for you to research in the future. And I've just mentioned it here because it's really good, and it's really, it's something that not everyone knows about. So I highly recommend you look at these 7 principles. But if you have any questions, please let us know in the comment section. Thank you so much for listening to our talk today, and we really hope you learned something and enjoyed it. You can contact us on Instagram at themedicaldebate, or you could email us on themedicaldebate@gmail.com to get in touch. We also host live Zoom events every single Saturday from 4 p.m. to 5 p.m. And to access those, please email us and we will let you know of the link. Again, please feel free to look at other sessions of ours, and our email, just to repeat it, was themedicaldebate@gmail.com. Thank you very much for coming, and we'll see you in the next session.